Absolutely. Okay. Thank you so much, Greg. That is good to hear. It is 9:01 on Breakfast Television. A new survey commissioned by the City of Vancouver highlights how the pandemic is affecting its residents. The survey says nearly half of people living in the city have lost their jobs or are working fewer hours. The mayor says the economic downturn could cost the city $500 million in lost revenue. He's calling for more aid from provincial and federal governments. He warns that without help, cities will have to take drastic measures. BC's next provincial health update is expected this afternoon. The latest numbers show we have almost 1,450 cases of coronavirus here in BC. Across Canada, Quebec is still hardest hit, nearing 13,000 cases. Ontario has more than 7,000. Alberta has 1,651. In total, more than 1,000 new illnesses bring Canada to over 24,000 cases, and that includes 717 deaths and more than 7,100 recoveries. Crude oil prices have lost their earlier gains. This comes after an agreement by OPEC and other oil-producing nations to cut output in line with collapsing demand due to the pandemic. OPEC, Russia, and other oil producers finalized a production cut of nearly 10 million barrels, or a tenth of global supply, hoping to boost crashing prices and end a price war. Canada's Natural Resources Minister says this country welcomes any news that brings stability to global oil markets. But analysts say the deal is not enough of an overall cut to truly put a floor under prices.
OPEC plus Russia plus the U.S. plus Canada plus 60 countries all told through virtual meetings and conference calls agreeing to cut daily output by 9.7 million barrels per day. That's about 10% of global energy production. It is historic by any measure.
10 more inmates have tested positive for COVID-19 at a federal corrections center in Mission. That brings the total number of infected inmates to 35. 5 guards at the prison have also tested positive. Last week, criminal lawyers called for inmates to be released early to help avoid a COVID-19 outbreak in prisons. Frontline healthcare workers at St. Paul's Hospital are now using the hotels across the street for some much-needed rest. Isabel Regem has more.
It was great because I worked a day shift at St. Paul's and I just had to walk across the street rather than driving an hour home, and I got up at 6:30 and walked right back.
Every night at 7 p.m., a cheering crowd gathers in front of St. Paul's in support of staff. And for the last 2 weeks, the neighboring hotel has been showing its support by providing them with a place to rest. This is St. Paul's Hospital in downtown Vancouver, where healthcare workers have been working tirelessly during this outbreak. And now, if they need a nap or a shower, they can head across the street here at the Burrard Hotel.
What we've seen most of has been the opportunity for the healthcare workers to come on site and spend a couple hours in one of our rooms, whether it was to nap or to shower and change, and basically have some relief from the stresses and pressures that they have across the street.
It's a much appreciated service for staff like Lauren Parker, who lives all the way in Squamish.
Having a place totally to myself to walk away after a busy day in the emergency, it was awesome. I didn't have to, drive all the way home and potentially expose my family or my friends.
The hotel says it's offering reduced overnight rates for first responders, while short-term visits during shift breaks, for example, are a fraction of the cost.
The hospital is paying for their staff to stay here and have their relax room, so there's no cost to the colleagues there at the hospital.
The hotel's general manager says it's been mutually beneficial. With hospital staff coming in, he's been able to provide his own staff with hours. And while most rooms remain empty, the new agreement has saved the hotel from shutting down completely.
Almost 100 total rooms that we've been able to support, so we're pretty thrilled to be a part of that.
He's also in talks with other local hospitals to see if staff there could also benefit from short-term retreats.
I could still self-isolate and still be at work on time, so it was great. I loved it.
In Vancouver, Isabel Regem, City News.
Okay, thanks so much, Isabel. Well, whether you're out for a walk or a run, new imaging shows how germs can be spread even when you're outside.
A newly released animation showing how social distancing recommendations may not be effective for joggers or those exercising outside. The animation shows even if you're 2 meters away from somebody and jogging from behind, their germs can still reach you. The video, produced by an engineering simulation company, instead recommends a staggered formation or jogging side by side.
The Union Gospel Mission is keeping its Easter tradition alive this weekend. This year's meal looks a little different, though. Instead of gathering in the dining hall, guests are lining up from a safe physical distance. The hot plates are being handed out to-go style. The UGM says the vulnerable members in the community are facing escalated challenges during this pandemic.
On top of everything they're already struggling with, our guests are more susceptible to catching the virus for COVID-19. Some of them are seniors, have underlying health conditions, or have compromised immune systems. When you're homeless, you have no home to self-isolate in. Many of the services that they've relied upon, like meals, shelter, community centers, are scaling down or closing. People who are low-income families with the school closures, they're struggling with not having food to put on the table. Women and children who are maybe in difficult home situations are more at risk of domestic violence or abuse. There's lots of challenges facing people, and things are bleak right now. A lot of people are scared. They're worried that they're going to get sick or worse, and there's not a lot of hope right now.
And organizers want guests to feel like they're not alone during this holiday weekend. This year marks the 30th year UGM has served an Easter meal. And Sunday marked the 40th anniversary of the Marathon of Hope. Canadian hero Terry Fox set out from St. John's, Newfoundland on April 12, 1980. The run was a cross-Canada tour, and Terry intended to run the equivalent of 1 marathon a day. He passed away from cancer before the journey was complete. Since Terry's death, more than $750 million has been raised for cancer research through the annual Terry Fox Run. Wait now, we are going to go to a live press conference in Ottawa where federal ministers are making an announcement. Let's listen in.
Good